All right. Man, do you want to kick us off?
Sure. Hi, good morning, everybody. So sorry. My name is Mandy Plonsky. I'm the Director of External Partnerships and Community Affairs at Northwestern Medicine. Very happy to see you all. Welcome to the December meeting. This year went really quickly. If you haven't already, please introduce yourself in the chat, your name, your title, and organization. We are recording the meeting, and the video link and the slides will be available on the website by Wednesday because April is awesome. Um, so shortly, we're going to be asking you to share and connect with each other in breakout rooms. So get excited for that. For those of you that are new, this is our mission and our pillars that help us keep focused. So we're uniting employers and industry partners to support an inclusive healthcare workforce, provide accessibility for unemployed and underemployed populations, and develop innovative responses to the evolving needs of the healthcare industry. And you'll see today, kind of throughout the agenda, that we try really hard to stick to these and make sure that we're working towards these pillars and the mission all the time. This is our ever-growing list of partners. These are the employer partners, and then we have several strategic partners. So welcome to those of you that are new, and nice to see those of you who have been here for a minute. And so for today, you'll see that, like I said, we'll be chatting with each other and taking a survey. So get ready for that. And then we're going to hear from the Public Health Workforce Collaborative and the Youth Pathways Committee. So just know that those are always places or meetings that you can join. So just let April or any of us know if that's something that you're interested in. And then at the end, there'll be time for announcements and anything else that I missed, April?
No, that was great. Thank
Oh,
you so
and then you
much,
get to hear
Mandy.
from me again. So yeah, I think that's it. So I'm going to turn it over to April and talk about what we've accomplished this year together. So thanks, everybody.
Thank you so much, Mandy. Hi, everyone. I'm April Harrington, the project manager of the Chicagoland Healthcare Workforce Collaborative. Thank you for joining us for our final meeting of the year. Mandy just went through the agenda. We'll also hear from Liana Braun at Cara, who they are hosting another of the Fair Chance Hiring Cohort. Many of our employer partners have already taken part in that cohort, but you can do it again. And if you haven't done it yet, you can also join. That's launching, I believe, in February. Liana will tell us more about that opportunity for everyone later on. And yes, there's always time for community announcements at the end. So if you have something you'd like to share, we'll have time for that. First, I'd like to celebrate where we are and what we've accomplished over the last year. So around this time last year, the steering committee got together to do some long-term strategic planning and think about how we wanted to envision our table 5 years out. What do we want to look like? How do we want to be perceived in this ecosystem? What sort of value do we add? And this is the vision statement that we come up with, that CHWC is a healthcare workforce development think tank led by exceptional healthcare leaders with experience in health equity, workforce development, community engagement, and diversity, equity, and inclusion. CHWC is recognized locally and nationally as an exemplary model of peer learning and collective problem solving. And I am happy to report that we have made a lot of progress towards that vision over the past year. On the left side here, you'll see that we've increased engagement in our table and really leaned into peer learning as the primary goal of this group. We hosted 3 in-person opportunities to connect. That was 2 in-person quarterly meetings and 1 employer-only peer learning session in February. We had met more often in person prior to COVID, but this was our first year really meeting that many times in person since the beginning of COVID, so that was great. We also had 6 virtual learning events that featured some of you all and your exemplary programs and policy changes that you've been implementing, as well as some partners from other regions who have brought in some examples of strategies that we might not be doing in Chicago yet. And overall, we've increased CHWC meeting attendance and virtual learning event attendance. Our newsletter reach increased by 50% over the past year. We established a LinkedIn presence for the first time. And we presented about our work at 3 different events. We presented to 2 other similar healthcare collaboratives in different regions about our model. And I also spoke on a panel at the Chicagoland Workforce Development Symposium. So we are doing our parts to increase the opportunities for you all to engage, increase awareness of this table elsewhere. And I think that this is one of the most important things. For everything that I can point to that CHWC has accomplished, the biggest thing is giving you all a place to connect and to partner with each other. There are so many other things that you all have done and has perhaps been spawned by CHWC connections that we can't quantify. And I'm super excited to hear a little bit more about that in just a minute. So get ready to share some of the things that you've been doing. On the right-hand side, you'll see that we've increased some of our actual impact as CHWC and our collaboration across partners, our more formal collaborations. We will hear more about our Good Jobs Challenge funded nursing assistant training hub later from Sasha. But we have had 71 individuals so far complete a nursing assistant training program. 62 of those are currently working as CNAs and still working as CNAs. And we'll hear more about that in a bit, so that's fantastic. We've also strengthened our collaboration with Malcolm X Community College through a couple of specific grant-funded initiatives. One is an initiative to build a patient care tech to associate's degree nurse pathway program in partnership with employers. That's at its beginning stage, but you'll hear more about it in the year to come. And an initiative to support Black male participation and success in health career pathways. Again, something that's in its initial stages and you will hear more about in the year to come. Finally, we've continued to explore career navigation and the challenges around that and how CHWC can help all of our stakeholders at this table build tools and bring more supports to students, to employees, to job seekers who are trying to figure out how to get in the door in healthcare or how to move up. We are supporting Women Employed's research project around this subject, and I believe we'll be able to hear about the findings of that research in the spring of next year. And we're also working with Innovation Nexus on a virtual career navigation tool, again, something that's launching in the spring of next year. I think we might have a quarterly meeting next year that is entirely focused on career navigation. So little teaser for what's ahead. With that, like I said, the biggest thing I think CHWC does is allow you all to connect and build partnerships with each other, strengthen your collaborations, whether that's with employers partnering with community colleges or with some of our community organizations who work in communities to help find quality jobs for community residents, any types of partnerships that you are doing on the ground. And so I'd like to take this opportunity to hear a little bit from all of you as to what you've been working on. So there is a QR code that you can scan to join this AHA slide presentation. This is just one question that we'll ask in this app. I am also going to put the link in the chat, and you can bring that up in a separate window. And so just share one, what I like to call a workforce win from your organization. It could be that you started a new program. It could be that you improved retention for frontline employees. It could be that you partnered with a new community organization. Anything really. It could be about one person advancing. And then I love to share these out with our meeting notes so you all have an idea as to what's going on across our ecosystem. Thank you, Destiny from Northwestern. You had your first student intern that is deaf and hard of hearing. That is amazing. That's amazing to be able to provide the programming that that student needs and to welcome them into your workplace. We have someone else who launched a nursing and allied health clinical program. Awesome. Give everyone a minute. Let me know if anyone has trouble getting into the AHA slides. It looks like people are typing. Oh, Candace, I've worked with Candace on this. They're developing a pilot program for frontline workers with a program called Talent Rewire. They did a lot of work to listen to their frontline employees, particularly those in EVS, to figure out how do you think about your opportunities to advance and what would you like with your opportunities to advance? And so they're building a program that includes some mentorship and some online classes for them. CCH is doing a completion of an EMT apprenticeship. I love the growth of apprenticeships. That's fantastic to hear about. Started monthly workforce Wednesdays. It doesn't say, but I know who that is. That's Loyola Trinity. Workforce Wednesdays to expose colleagues to no-cost programs at community colleges. Amazing. Another one at Rush, they had their third cohort for the PCT apprentices, and all of them passed their state exams. Congratulations, that's really impressive. We have 3 healthcare employers as part of the 2024 Fair Chance Hiring Cohort. Amazing. I love that, you know, I get to meet with people who convene employers in other sectors all the time. And healthcare, you are always the ones who are the star students and participating in these cohorts and really thinking about your hiring policies. And I'm so proud to be working with you. What else here? We held our largest graduation class for the CNA Partnership Program at the Shirley Ryan Ability Lab. So happy to see folks from the Shirley Ryan Ability Lab join us here today. Thank you, Marcos. Some of you might remember Marcos from his time at Rush. Welcome. Matt, everyone will hear more about this later, but they formed a youth advisory council to support the Youth Pathways Committee of youth themselves. I think it's fantastic. Every way that we can bring in the voice of students, of employees, that's really important. And Jana at Northwestern hired high school program alumni as full-time and part-time staff. That's amazing to hear when the internships and programs that we build lead to actual hires. I know that's a hard thing to do sometimes. And Tasha's sharing their participation from Larry at the Good Jobs Challenge for CNAs. And I know that they're expecting to extend some offers right about now. So exciting. I'm going to give this about 1 more minute. So finish up your workforce wins. Oh, and Jeremy shared one in the chat. Successfully completed reaffirmation with our accreditor. Oh, that's a big thing. Congrats, Jeremy. And reauthorization with the U.S. Department of Education, expanded sterile processing and surgical technology programs in the South Side. Very impressive. That's from Midwestern Career Colleges, if anyone is interested. Speaking of our training providers, Anna Tukenvor from TTI shared that they increased male enrollment in healthcare in healthcare programs with targeted outreach through their Men in Healthcare campaign. They successfully encouraged more men to pursue careers in fields like phlebotomy, hemodialysis, and CNA, fostering diversity and strengthening the healthcare workforce. I know that's important to so many of us here. Congrats on that. And thanks for sharing, Anna. Levi recruited a new member to the Foxglove Alliance, the Academy of Medical Surgical Nurses. Another fantastic table. Thanks, Levi. Okay, it looks like everyone is done typing, so I'm going to stop there, but congratulations to everyone. We've had a great year. I hope you're all feeling very proud of yourselves and like we're ready for 2025. So let's talk about that. Here are just some initial plans for 2025 that came out of our steering committee retreat a couple of weeks ago. One of the things we'd like to do is to increase the use of data. Some of you who were at the employer-only peer learning session in February might remember that I brought in some data from Lightcast. Lightcast pulls from different public data sources, and also does a large scan of all the job posting sites. Mm. Um, so we'd like to bring those Lightcast reports to this table more frequently. I'd like to bring sort of sector-wide snapshots to everyone here on a regular basis and bring occupation-specific or program-specific data into particular conversations so that we ground our discussions in data and help you all with the information you might need to ground your conversations with stakeholders. So we're going to try and do that. We want to continue foster peer learning. We did a lot of that in the last year, and we want to continue to increase that. So we'll host regular learning events and opportunities for people to connect in person. We also tossed around the idea of doing a sort of hackathon or peer learning roulette type of event. I think I need to workshop the name a little bit, but the idea would be that prior to, employers would provide a short list of things that they're doing really well at. Maybe you've launched some programming that recently that's doing well, you've figured out a strategy that you feel like you can share with someone else and share some advice. And then on the opposite end, the things that you're struggling with. Maybe you're trying to build a program or change a policy or think about a particular strategy that you haven't had a lot of experience in, and you're looking for an employer who has had that experience. So doing some matching so that you can sit likely in person and share those strategies together. And then finally, in our conversations at our steering committee retreat, we talked a lot about the data that we could pull from Lightcast and what was so valuable about it. We talked about how we could continue to strengthen our partnerships with our local community colleges, which is something that's really happened over the past year. And we felt like it's difficult to talk sort of broadly when a lot of these partnerships happen at an occupation level. Um, so we decided it would be a good idea to start having some occupation specific discussions, starting with one of our big needs, which is respiratory therapy. A lot of you here know that we have a large need for respiratory therapists in our region. It is a very difficult position for our hospitals to fill. It is also or it has some attributes at least of a quality job. The median salary for respiratory therapist in our area is $80,000 a year, and it only requires an associate's degree. But we don't have enough programs, we don't have enough seats to meet the demand, and it's a really difficult position for us to fill. So we are going to get together a respiratory therapy summit, bring employers to the table, including those who represent your respiratory therapy teams and can speak to that specifically, colleges who have respiratory therapy programs, as well as those who don't, but might be able to start one, and other stakeholders. We will ground that conversation in data and try to co-design some solutions to that talent shortage. I would like to start convening a small planning committee for that summit starting as early as January. So if you have someone that you would like to nominate, someone with some specific experience, specific knowledge of the respiratory therapy pathway, please feel free to drop that in the chat directly to me or email me with your nominations. I do not yet have our quarterly meetings mapped out for 2025 just because of some scheduling conflicts. I'd also like to hear from you in the survey as to how many of those you'd like to have virtual versus in person. I will get those dates set by early January and get them on your calendar. But I do have one date to share with you. We have a lunch and learn with the Chicago Cook Workforce Partnership. They are the nonprofit umbrella organization that operates the largest public workforce system in the country, and they manage all of our public workforce dollars, specifically our WIOA dollars that come from the Workforce Innovation and Opportunity Act. They also have a healthcare sector center that exists to support healthcare employers. They host hiring events. They also can be a source of talent for you. And most importantly, or perhaps of most interest, this can be a source of funding for some of your programs. There are on-the-job training funds that can help you support the cost of training new employees, and there are incumbent worker funds that can help you support the cost of upskilling your current employees. So let me put the registration for that in the chat. It is on January 28th. There we go. And all of our events can be found on CHWC's events page on our website, as well as recordings of our past events and slide decks of our past events. So if you didn't see those 6 learning events we hosted last year and you'd like to check them out, you can do that on our website. Okay, another opportunity to connect. Like I said, I feel like the biggest thing that CHWC can do for all of us is help you all meet each other, learn about what each other are doing, and then partner. So I'd like to make an opportunity for that right now, just 10-minute mini breakout rooms with about 3 people each. You're going to introduce yourself, talk about why you participate in CHWC. Sorry, I'm trying to do the breakout rooms and talk to you at the same time. I should focus. Uh, and then what workforce partnerships would you like to build or strengthen in 2025? So are you an employer that is looking to build more partnerships with community organizations who are working with talent directly? Are you looking to strengthen your partnerships with community colleges? How? Why? And my hope is that some of you meet someone new, are able to make a connection that you want to follow up with, or some of you might be able to catch up with someone you already know, which is also great. So I will drop these questions in the chat so you remember what they are. I'm going to open the breakout rooms right now. We're all with about 3 to 4 people. So you should be able to join those, and we will come back it'll be 10 minutes. So right after 9 o'clock, I'll pull you all back. Does 1 or 2 people very briefly want to come off mute and just share an exciting connection they made, or some sort of synergy that they felt with the 1 or 2 other people in their breakout room?
April, I'll go. It's Joanne from Lurie. I had the lovely opportunity to meet Cassie from the Chicago Cook Workforce Partnership, and the work that self and Natasha and other people at Lurie are doing. She's like the go-to for the Good Jobs Challenge. And so it was really nice to be able to actually meet the person who has been so integral in getting that up and running and being able to make that connection. So she was a pleasure to talk to.
Oh, yes. I'm so glad you 2 met.
Yeah, I want to piggyback on Joanne. And I know this is going to sound a little selfish, but I'm glad it was just me and her on the call, me and her in the room, because I just felt a just organic connection with her. So thank you so much.
Oh, I'm so glad you had that opportunity. Tasha?
Oh, let me lower my hand. So I had the privilege of talking with Allison from Ascension and Zora from Shirley Ryan. And so primarily I talked with Zora because Allison was having technical difficulties, but it was such a pleasure to talk with her, and we're going to connect offline.
I love this tag. Zora?
I was actually going to say the exact same thing. I had the pleasure of talking to Tasha and talk to somebody who's been working with CHWC for some time, whereas I'm new to this organization in this community. So, and Tasha's our neighbor, so we're definitely going to connect and have coffee and pick each other's brains. Mostly me picking her brain, but yes.
Oh, I'm so happy. I'm so glad to hear that people had productive conversations that you're going to carry away and meet up after today. That's exactly what this space is for. And with that, I would like to get some feedback from all of you as to how you see the value of CHWC and what you would like to see us do a little bit more of in 2025. We always do a year-end survey, but this one is just a little bit more in depth. It should take 5 to 10 minutes. And so I'm actually going to give you 6 minutes to do it right now. If you don't finish it by then, that's okay. I know all of us are adept multitaskers. As soon as we're done with the survey, we'll have a few presentations. So you can continue to finish it throughout the rest of the meeting or after the meeting if you'd like to spend some more time. There are a few pages to the survey. Some of them are easy multiple choice questions, but there are some opportunities to share your thoughts. So I am going to put on one 6-minute song and let you all start that. And then we will dive into our updates on the Good Jobs Challenge, the Public Health Workforce Collaborative, the Youth Pathways Committee, and hear about the Fair Chance Hiring Cohort. And I don't always play music on my Zoom. So if it sounds crazy or too loud, let me know. All right. Matt was right. That was Hank Mobley, Dig Dis from the album Soul Station. I feel like I'm on the radio. Thank you all for taking the time to do that survey. Please, if you're not done, take your time finishing it, and I'll be sending it out in our next newsletter to hopefully get more responses from everyone in our network. And I will share out what I've learned in January or at our March quarterly meeting, more likely. But I'll be sharing it with the steering committee, and we'll use that to finalize our plans for 2025. With that, let me pass it off to Sasha Ongtenko to give us an update on how things are going with the Good Jobs Challenge.
All right, sorry everyone. Was finding my unmute button there. I had my screen all ready to screen share, and then of course couldn't find my mute button. Thanks, April, for getting us in the groove. And I will I feel like I wish all Zoom meetings just had music in the background. As April said, I'm Sasha Ongtenko. It's great to be here with everyone today. Pronouns are she, her, and I serve as the Pathway Programs Coordinator for Good Jobs Challenge. And for those who are not aware of the Good Jobs Challenge, or who just maybe are here for the with the collaborative for the first time, at the Good Jobs Challenge funding is part of is funding that was awarded to the Chicagoland region by the Economic Development Administration. The Chicago Cook Workforce Partnership is our lead organization, and 4 sectors were awarded funding to support the creation of career pathways into living wage jobs or jobs with career tracks, and being able to increase economic mobility for individuals from disinvested communities. So we have target populations that we are looking to serve with Good Jobs funding. It's also uniquely incentivizing collaboration among sectors. And so Chicagoland Healthcare Workforce Collaborative is representing the healthcare sector together with the Public Health Workforce Collaborative, whom you'll hear from Matt in a second with updates. But we are sharing funding, and with Good Jobs funding, the Chicagoland Healthcare Workforce Collaborative has launched a nursing assistant pathway programs hub. And so we have 5 employers who you see listed here: Loyola Medicine, Lurie Children's Hospital, Rush, UI Health, and University of Chicago Medicine systems. And they have locations or hospital campuses, some of them in multiple locations around the city, really in selecting or working with these hospital systems. They all had existing nursing assistant programs. And so we were really excited to be able to either revive a nursing assistant program or sustain program from previous funding, allowing for that hospital system to continue to evolve it or adapt it. And the caveat was being with the good jobs lens in mind was really going at it to interrogate the idea, can nursing assistants as a frontline role, an essential frontline role, actually, is it that access point and that stepping stone into a healthcare career path, as it's often promoted um, to different prospective individuals looking at healthcare entry. And part of the Good Jobs Challenge Hub's mission is coming together to work together to really look at improving the job, improving the experience with training, and most importantly, in being intentional about career path development early on from the get. So we're doing career exposure within all of the programs and really looking at skills development and thinking about just the student, or rather the participant and employee experience. And so you'll see just on this quick graphic here, we're really focusing in a way that is most unique because of the community of practice to really talk about best practices and to share out what we're learning and what we're seeing, and then sharing those learnings as we continue to have cohorts start and complete and get jobs, to share that back out with the greater network here at the Chicagoland Healthcare Workforce Collaborative and at meetings like this at our quarterly meeting. Coming up, since the grant has been active and it goes through September 30th, 2025, we're going to be with 2025 around the corner. We're really looking at nursing assistant programs and working with our training providers and CBOs, and just kind of this greater network of partnership to improve job quality and the experience for CNAs. We're looking at program interventions and ways we might want to tweak the model, or what, when we're looking at the data and talking to participants, talking with career path advisors, which are previous CNAs who have advanced in their career paths. So we're kind of engaging employee voice really intentionally. What are we learning and how might we be able to design or think of a little intervention to possibly improve the experience, again, thinking about how individuals might advance more quickly and have more exposure about their options. Would they retain? Would they continue to move forward as opposed to exiting because we already know that the position itself is a difficult position. There's a lot of work needed around pay and just there's a lot that the hospital systems and all of us together as a sector can do to really ensure that that certified nursing assistants have a variety of options, not just nursing, to be able to advance in. And so what you see in front of you here is our dashboard. And so we've been sharing the dashboard at our quarterly meetings. And then we do look at this every month when the community practice, which again are the nursing, the hospital system partners who are recruiting and hiring our CNAs from the community, and then training providers who are partnering, again, to provide the training and instruction. But there's a lot of deep communication and collaboration within the multiple partners involved. And we were really happy to talk about that at the last quarterly meeting in person through a panel, many of whom are here today on the call. So what you'll see so far, since we began our first cohort with the Rush PCT apprenticeship cohort that launched October 2023, since then, we've had 138 individuals begin training. And we have 71 individuals as of the beginning of this month having completed training. 76 individuals began jobs, and I'll explain that in a second. And of those, we still have 62 who are currently actively employed in their role at the hospital system that hired them. Average starting wages across those jobs is $18.34. I think it's pretty notable there that when we're talking about living wage jobs, especially here in the city of Chicago and in Cook County, This is a wage that needs to continue to inch up, but we're thinking about benefits when we're thinking about access to within these hospital systems, a variety of options that have viable career paths. And knowing that nursing assistants are so important, to focus on nursing assistants, to not just ignore that the job is what it is, but really think about how can we improve this, is why we have selected this job and really chosen to mobilize our different partners around how we might continue to develop and improve training and job quality in that role. Jobs so far individuals who have been employed are working full-time jobs, and they're not only at the hospital systems that you see represented, but have been also were placed at other systems within our own network, at other hospital systems, because again, if we're thinking about it, working together collaboratively and as a sector, and thinking about our participant experience and their access to employment, other hospital systems were a better fit, and that's again, individuals being able to inform that. So we have some folks working at Mount Sinai, and we have individuals who trained with UI Health within their program with Tugendorf Training Institute, who still were able to get placed at a hospital that was nearer to them. And again, that's all part of working collaboratively. With 76 individuals being employed versus 71 people completing training, how does that work? Well, the reason behind that is because 2 of our hospital system programs are actually apprenticeship programs. So both Loyola and Loyola Medicine's program and Rush Medical downtown and Rush Oak Park have apprenticeship programs in partnership with Valparaiso University. And individuals start working from the get and then continue training, and then the contingency with completing their training successfully and obtaining their license, passing the state exam, are all required to continue moving forward in their role as a certified nursing assistant or patient care tech. And so for individuals that started as apprentices but then did not complete training, explains why they are employed to start, but then our training number completed is lower. So we are very much a proponent, of course, of apprenticeship models where there's the opportunity to continue working, earning, and learning. And we still do see it as a success if someone does come to find that after training that they recognize that this is a role that is not for them. I've exercised communication around that. And so there are, in terms of variety of the reasons that people have attrit, some of it is still related to things like time management, and not meeting standards because you're on a job, especially at the apprenticeship level. It's technically going to work, even though you're in the classroom. And then once you start clinicals, it's a step up, but still, we've seen that in the attrition, there's a lot of learning in there that we want to dig into, especially from the participants themselves. And so alumni, I'm going to move now into some of our updates for coming up 2025 and kind of what we've done, what we have planned ahead as a result of what we've completed this year. And some of those things do include connecting still in a meaningful way with our program participants through alumni interviews. So being able to talk one-on-one and dig deeper versus just what we have currently is standardized surveys. So again, our training partners involved in this hub are Tugendorf Training Institute, I know who's here on this call, Valparaiso University, and Malcolm X College. And so their CNA or BNA programs or apprenticeship programs are also key partners in helping us identify individuals for those interviews. They've also been really helpful and key in thinking about program interventions. And as we kick off 2025 with a retreat, we're looking forward to bringing, again, the full community of practice together in person to start thinking about program interventions, because we'll be able to look back at all of the survey data. We do pre and post surveys for each nursing assistant program. So there's like a lot of learning ahead there that we look forward to also sharing, likely in the March quarterly meeting with all of you. We're also looking at doing our second career path, our second certified nursing assistant facing career path networking event. We had a virtual one a few months back where we brought previous CNAs across a variety of positions who've advanced into a variety of positions in healthcare, but not just nursing. And so we're looking to continue to engage that group of external supporters of this work to help us improve, to help create connections and opportunities for certified nursing assistant graduates of these programs. And again, expand, just continue to expand and strengthen like the connective tissue around all of us to help us learn. We also have other key partners involved that provide supportive services. There's Phalanx in the mix, Phalanx Family Services that provide wraparound supports to ensure that participants make it through training. And then we also, with LISC and LISC, Local Initiative Support Coalition, Chicago, and their network of financial opportunity centers, have been assigned to various good jobs hubs or good jobs sectors. And so we're working with Metropolitan Family Services who are providing financial workshops, financial literacy workshops and one-on-one coaching. And so that's another support service that our folks can avail of. And we're looking forward to have another one this upcoming year. And then with that last slide, the one I spent a lot of time making, I was really excited because it was a reflective moment for me to think back on all that we've done already. And looking forward to 2025. So thank you, Good Jobs Partners. And then looking forward to 2025, my typo. We've done, you'll see just photos and faces of our cohorts at orientation from our, I remember the kickoff at the start of this experience at Olive Harvey, and we had our Deputy Secretary of Labor come to visit. We recently you'll see on the right-hand side, top right corner, members of our panel who spoke to our larger healthcare collaborative network about learnings from their programs and the meaning of collaboration. And so we, again, just are really, with all that's the twists and turns of this year of the grant and continuing to mobilize partners and work with individuals who are going really committed to their own development and seeing that as they continue to advance and being able to hear the stories or meet them at orientation and then get to see them again or hear about where they're working at as they get placed has been really one of the most meaningful moments of this altogether. But I think the collaboration, as we've heard in past meetings, has probably been just as rewarding. And so I'll leave everyone with that. Not sure how I did on time, but if there are questions or if anyone from the Good Jobs Nursing Assistant Hub might want to chime in on anything or speak in the chat about something that just sticks out, something that you want to celebrate about this, please feel free to. I would love to hear just, reflections in the chat, knowing that we have a lot more to go for our meeting and updates to hear from. But thank you all.
Thank you, Sasha. I love the collage. Thank you for putting that together. It's great to just, see the real faces of people who are impacted by the work that we do. We, like Sasha mentioned, and as many of you were present, our September quarterly meeting was entirely devoted to our Good Jobs Challenge work. I expect that we will have another quarterly meeting in 2025 that similarly will be devoted to that work and everything that we've learned and accomplished. So stay tuned. If you have questions about the Good Jobs Challenge for Sasha, please feel free to put those in the chat. But for the sake of time, I'm going to pass it off to Matt McClintock to sail through some quick updates from the Public Health Workforce Collaborative and Youth Pathways Committee, both are which groups you can join. And then we're going to move on to Liana and the Fair Chance Hiring Cohort.
Awesome. Thank you, April, and hello, everyone. Good morning. My name is Matt McClintock. I am joining us from Health and Medicine Policy Research Group, here to talk a little bit about the Public Health Workforce Collaborative. The Public Health Workforce Collaborative is the sister table to the CHWC, focusing, of course, on public health roles and smaller community-based organizations. So you can see on my slide here, I have our next meeting scheduled, which is this Thursday at 1 p.m. Don't worry, there is contact information for you to get involved in that. I wanted to show you all our vision and mission statements. The Public Health Workforce Collaborative, which, by the way, is actually not convened by myself. It's convened by my supervisor, Anna Yankelev, who cannot be here, so I'm kind of speaking on behalf of her and behalf of the group. So anyways, the Public Health Workforce Collaborative is really committed to building and strengthening the public health workforce. We do that through supporting workers, investigating career pathways, and building capacity. We do that by working in our action teams. So each one of those mission statements is an action team in and of itself. And each one of those action teams has upcoming meetings in early January, as you can see. So in the supporting workers action team, we really think a lot about workplace equity and worker voice. And we're very much interested in this idea of a worker center, I believe it's called, or a worker-led worker center. Really a way that we can amplify worker voice. Yeah, the other action team is the Career Pathways action team. We focus a lot on public health careers, not only teaching folks about what those careers are, but also how to get there. And so we do a lot of that work through the Career Pathways resource, which is forthcoming in early 2025. But then we also do that through Good Jobs Challenge funding as well. In the capacity building action team, we focus a lot on sustainability, particularly funding sustainability for community health workers. With our Good Jobs Challenge funding, we have focused on these public health roles in community health work, behavioral health work, and reproductive health work, medical assistance, and emergency response. So in total, the Public Health Workforce Collaborative has trained 88 participants in 2024. That includes 31 doulas, 26 medical assistants, 14 midwives, and 17 community health workers. Additionally, we have been contracting with a third-party marketing agency, and we do have print recruiting materials if anyone is interested in seeing either a poster that is dedicated to one of these pathways or a brochure that talks about the program at large. We still are recruiting for the EMT and paramedic pathways. We're recruiting for the community health worker pathway, and we're recruiting for the behavioral health worker pathway. Moving on, I'll talk a little bit about the Youth Pathways Committee. The Youth Pathways Committee is kind of sits between the CHWC and the PHWC, and of course focuses on building accessibility for young people who want to pursue their careers in either healthcare or public health. So we recently had a meeting last week. We talked about what happened in 2024, set our priorities for 2025, and a big priority of the Youth Pathways Committee is centering and uplifting youth voice. And so, as I mentioned earlier in the meeting, the Youth Pathways Committee has formed a Youth Advisory Council. This is an advisory council made up of 10 young people, ranging from the age 14 up to age 21. And as the name suggests, they advise us on the work that we do. And so we use them to guide our initiatives. But another thing I want to talk about is some of our outreach and exposure work that the Youth Pathways Committee does. The Youth Pathways Committee will be partnering with World Business Chicago to do these bus tours for CPS students. And currently, we're recruiting employers that would be willing to host students to come to their site, do a little activity, and learn about the careers, the workers that are at that um, at that site. And so I'm currently planning this with World Business Chicago, working on the interest form that is soon forthcoming. I will send it to April to make sure that is included in the newsletter and sent out to CHWC partners. Additionally, we are working on scaling mental health support, and we really are partnering with a group called the National Alliance for Mental Illness. They have a program where they actually teach high school students how to be certified peer support specialists. And so we're working on taking that program, which is currently in the pilot phase at one school, and expanding that to more schools. Additionally, we are continuing to expand and reimagine the Speakers Bureau, where healthcare professionals go to various classrooms to speak about their work. And we want to work on deepening the pathway ecosystem. So similar to the CHWC, we want to create this peer learning space, both through lunch and learns, but then we also want to focus on educational institutions and facilitating dialogue between teachers, both at the high school, college level, and industry professionals. So if you'd like to learn more about the Youth Pathways Committee, please email me. You can see my email here on the slide. You can email me with more information about Good Jobs Challenge or even the PHWC, and I'll check the chat to see if Anna's email has been dropped for the PHWC.
I dropped her email and your email.
Okay, perfect.
You've
Awesome.
got
It's all in there. Yeah, that's it for me. Thank you, everybody. I'm happy to be here, and I'll pass it back to April.
Thank you, Matt. I know that was a ton of information. If you want to get more involved with the Public Health Workforce Collaborative or the Youth Pathways Committee, I highly recommend that you do. You can always email me if you don't remember Matt's email or Anna's email, and I'll connect you. With that, I'm going to pass it off to Liana Braun from Cara Plus to talk about the Fair Chance Hiring Cohort. As she's presenting, please feel free to put any questions in the chat. And Liana, if we could just end by 9:55 to leave a few minutes for community announcements, that would be
Yes,
awesome.
of course.
Thanks.
Good morning, everyone. I'm Liana, and I'm so grateful to be here again. I love this group. I'm so excited to see so many familiar faces. My face is probably also familiar to some of you because we've worked together through Cara, or because you've heard this presentation before, because this is not our first Fair Chance cohort. This is actually the third we're doing in 2025. We partner with the Corporate Coalition, so that's another employer table, as well as the Chicagoland Workforce Funder Alliance. And at this point, you've heard April mention, we've actually had 4 employment partners from CHWC participate. So this is a great opportunity to learn about what Fair Chance Hiring might mean for you, to hear about how some of your peers have been thinking about this. So with that, I'm going to do like a very quick level setting, like what are we talking about? The good news is you won't hear from me this whole time. We'll get to hear from Mandy again from Northwestern Medicine, and then some of the highlights about the cohort, so you can see if this is a good opportunity for you. So I'm going to start with the basics. What is Fair Chance Hiring? There's a lot of names for this, right? Some people talk about it as second chance hiring, but when we talk about Fair Chance Hiring, we're really talking about how employers are engaging the 1 in 3 US adults that have some kind of criminal record. And that could mean that they've been incarcerated, arrested. It can mean a variety of different things. But if you take anything from the slide, I think the one thing is what you see on the left, which is Fair Chance Hiring is really about helping individuals, regardless of their background, be fairly assessed for a role that they're qualified to fill, right? So we're talking about how you can reach into this talent pool. Again, that 1 in 3 number, that means that so many individuals in the US are impacted, which means many of you are already hiring from this population. So it's how do we do this intentionally? And then another thing, I'll mention here, because I know so many hospital and healthcare systems in this group are being so mindful about the impact you're having as anchor institutions in your community. So you'll see that statistic that 600,000 men and women are released from jail every year. So again, we're talking about not only your opportunity to reach talent that is often retained higher, has really strong performance and advancing in organizations, but also thinking about your potential to have some impact in your communities. And then I think just as a good counterpoint, I like to talk about what fair chance hiring is not. I think there's two important things. And so the first one is many times we go straight to the background check. That's the thing we have to fix. But actually this journey is much more about that candidate experience or that employee experience in all the different moments people either might be included or not. So really thinking about your full talent life cycle and how fair chance talent is being included and leveraged. So that's, I think, one important point. And then the next piece before I'll, we'll get to hear from Mandy, is sometimes people think, oh, well, we're a healthcare organization. There is rightfully so a lot of regulation and things to make sure patients and employees are safe and cared for. So when we talk about fair chance hiring, we recognize that means something in this context. And we're not saying get rid of the background check. We're not saying that means you are totally doing away with any of these protections or ignoring any of the regulations. It's really about translating how do you engage that talent pool in a meaningful way for your organization in your industry. So that's just the one thing I just want to be very clear about. Okay, so now for the fun part. We're going to bring Mandy back. I'm going to stop sharing the screen so we can look at each other's faces. Mandy, there you are. It's so great to be with you in this space.
You too. Yes, thank you for including me.
Of course. And it's always great to hear directly from employers that are thinking about this and doing this. So, for this group, I'm just going to ask you a couple of questions about your experience in the cohort, but also just how you're thinking about fair chance hiring. So I just want to ask, tell us about how Northwestern Medicine is approaching fair chance hiring and how that evolved in this last year that you've been in the cohort.
Yeah, thanks. So it turned out, and I did this in as Northwestern does, like we have several people on this call, we roll deep to everything that we do. And so we did this in collaboration. First of all, like I said, we do anything that Liana or April tell us to do, and that's the spirit of CHWC, because we just learned so much. So this just seemed like another example of how to do that. And so we brought myself and Brian Stewart from Community Affairs. We had our talent acquisition crew. We also brought someone from compliance, which turned out to be really important too. And so when we started to kind of think about it, we looked at everything that we were doing, and it turned out that we were actually sort of like ahead of the curve in terms of best practices for fair chance hiring. But what, and many of you who work for enormous organizations understand, is that a big part of it was sort of thinking about the communications aspect. So there was a lot of internal and then external communication and awareness building that we needed to do. So that was sort of, and tends to be with literally everything that we do, the biggest hurdle. And so I guess from an internal perspective, we talked to everybody from the CEO to the head of HR to everybody, just to level set and understand, make sure that they understood what we were already doing and kind of where we wanted to go. And I'll say this a couple times, but it's really true. We never, ever encountered any pushback from anybody in terms of the spirit of the work or anything like that. It was more just like bureaucracy, right? You have so many steps to go through, but nobody ever said, no, don't do that. I mean, obviously there was caution, mostly from compliance, which is their job, and I'm grateful for them. But nobody said no. In fact, I think honestly, the people from compliance were the most thoughtful and just wanted to be doing the right things. It was just, they just wanted to make sure they were doing it the right way. So there was a lot of that. We created a video which forces your leadership to think about it because they have to talk about it on videos. That really helped. And then we actually, on Thursday, we're so excited. We're bringing Liana and her team to do a reentry simulation with our entire talent acquisition team, which we are so thrilled that they're partnering with us on it and that our leadership is embracing it in a way that, they can help their team to think, just more empathetically and just understanding of the people that they face every single day. So sorry. And then externally, sorry. So the biggest piece is that, changing a little bit of the background check piece. So we did build, shorten our look back time. So that was something really impactful. I think it was 7 years before and now it's 5 or something like that. Please don't quote me. Definitely don't quote me. And then the other piece was changing some of the language, both on our job descriptions and then our career site, because again, it was just that piece was in place, the strategy was in place, but it was more of the communication of it, just making sure that people knew that we are fair chance friendly and that we want to make that clear. That we also are going through a job code consolidation and updating every single job description is really a lot of work in a place with thousands of job descriptions. So that's taking some time, but it's in the work. So just because it's hard doesn't mean you can't try. So I'll stop.
Thank you, Mandy. And I continue to be so inspired by your team. I will attest, we had our kickoff last January and it was like 8 people from NM just like coming in and doing the thing. And that's exactly what it takes sometimes, is just figuring out what this means for you all, but doing it in a way where you did the hard work, you took these steps one by one. And so it's been great to see you on this journey. I think the second question I have for you and, for the group is kind of why should healthcare employers consider fair chance hiring as part of their talent strategy, and maybe where should people think about starting?
Yeah, I mean, I think what the statistic you showed before, like you don't have a choice. So if 1 in 3 people are impacted somehow by the criminal legal system. I mean, we are, when you're having thousands of people apply for every job, you don't have a choice but to have a strategy. So it's important to look at it and kind of lift up the hood and see what's happening. And I think in terms of where to start, that's exactly where we started. And so we went to the compliance team and met with them and just asked them questions like, how does this work? Because it really is sort of this like black hole, black box of like, we don't know what happens once. And the TA team honestly doesn't know what happens. It's sort of just this closed system where, if there's a background hit, it goes to this team. Nobody really knows who's on it or who's talking there or, and what they're saying and what kind of metrics they're using and all of that. And it turns out that that's true at so many places, that this is sort of like a secretive thing because it needs to be. But at the same time, we need to understand like what is happening there to make sure that it's being equitably applied and that it makes sense. So that was sort of where we started, and that's where we started to learn that a lot of what we were already doing was the industry, like the right things to do, but just so that people knew. And so like I said before, nobody said no and nobody said we don't want to keep moving forward, and so that was really helpful. I think another piece of it too that has been helpful to us in general is we recently named a new chief health equity officer, and so that's just become increasingly important in our work at Northwestern, and thinking about how that applies both in the community work and in everything that we do. And so it's clinically and administratively, and so just trying to work hard to make sure that it's kind of the thread through everything. And so that also, the timing for that was good. And so, yeah, I think just start asking questions and just finding the right people to ask questions to, because like we all know this is there are a lot of steps, but it's just kind of asking the questions and working one by one and going on to the next person to say, why do we do it this way? And the answer is because we always have. And then you say, okay, great, let's try to do it differently.
Mandy, I love that idea of like just start by asking the questions, seeing what's possible. And I think what's interesting from this group, because I, at Cara, we've worked with many folks in this room. I'm seeing familiar faces, I'm seeing familiar names. And so many people have different ways in of thinking about talent. Sometimes, literally, I've heard teams say, we have a fair chance pillar in our talent priorities. Sometimes I've heard teams say, we really are leading with equity. If you're leading with equity, you have to think about how that particular barrier shows up. Or folks are thinking about, okay, we're hiring from the South and West sides. Unfortunately, we know that those communities are disproportionately impacted. So regardless of kind of how you're thinking about engaging talent, for all those reasons, we know you're going to run into this. And how can you start asking questions so you can be intentional? And then I guess just final question for you, Mandy, kind of like in maybe 30 seconds or less, what has been most valuable about the Fair Chance cohort? How can maybe people think about it benefiting their organization?
Yeah, I mean, I think you just learn just so much about what others are doing, and that helps you kind of ask more questions of, can we do it that way, or is that something that we haven't thought about? One really amazing thing, and you've all seen, or many of you have seen the advocate team talk about their employee success coach. We were able to take that model, and we're in the process of getting that job code approved through this crazy system, but we're super excited that we're going to be hiring a similar role for the team. So that's something that we learned and we're taking back, and we're just incredibly excited about. So another piece is that you'll hear from so many staff that have lived experience of this work and how that it played out for them, and that building that empathy and understanding with the team was so important, and I think will be super important as we do that tomorrow with or Thursday with the Fair Chance, or the reentry simulation. And yeah, I mean, I think that just learn, like all of these things, just learning from each other, having the space and time to think about it. I think the fact that our teams gave us the space and the time to think about it together and to work on it, and the support to do that was critically important. And we all know that the day-to-day gets like time consuming in meetings and all of that. So when you have the space to really, really think, which the cohort absolutely gives you, it helps so much. So thank you, Liana, for all of your support and everything that you do. And you do it with such joy. So we're grateful to have you in our corner.
Yeah, likewise, Mandy. And I think that one of the biggest plugs I can make is, again, this peer learning aspect. What Northwestern Medicine and Mandy's team was able to accomplish. We want to keep that learning going for the next cohort, and we keep having these champions make a little bit of progress in this space and then kind of share back. So just to close in about 30 seconds, I'll just highlight this experience really is about taking a little bit of space to think about some of those best practices. I saw some comments about, well, how does some of the best practices impact some other populations? They maybe have different barriers. A lot of these practices are going to impact different populations that may be experiencing barriers. The second thing is it is really action focused. So we're not saying you have to do any particular thing. You don't have to do a fair chance pilot, but it really is about taking some of those small steps and then certainly benefiting from that peer learning. So we'll share these slides afterwards, and this is kind of what the journey looks like in more detail, what that commitment might look like, but I'll put my contact information in the chat if folks want to learn more. So thank you so much, and looking forward to staying connected with you all.
And always happy to answer any questions that other people have too.
Thank you so much, Liana and Mandy. I learned a lot. I'm very impressed with everything you're doing with Northwestern. We always pack it into these meetings. You will get all the slides. It'll be on our website tomorrow with the recording. With that, does anyone have something that they would like to share with the group? Feel free to just come off mute, raise your hand. Levi?
Yeah, real quick, I just put this in the chat. Essay contest, nursing essay contest. Headstone actually runs a online only medical humanities journal, and we have like 34,000 subscribers. We average over 1 million page views a year. and we're having a essay contest, 500 to 1,600 words. Deadline is January 15th. And the second place prize is $2,000, and the first prize is $3,000. So we're hoping to get as many entries as possible from working nurses, nursing students, retired nurses, and just share their stories. And if you just click on, please pass this out to anybody you know. And at minimum, you will be published and probably be seen by thousands of people around the world. So that's it.
That's a really cool opportunity. Anyone else have something to share? No? All right. Well, I will send out our last newsletter of the year next week. So if you have anything you'd like to announce in that newsletter, let me know. Again, we don't have the quarterly dates set for next year, but those should be set by mid-January, and I will get them on your calendar. Thank you all so much. Have a fantastic December and New Year. It was great to see you all. Thank you. Have a good rest of your week. Bye.